welcome to another episode of Doc Talk with Monument Health. I've got Dr. Joy Mueller with me today.
Hello.
Hi, how are you doing today?
I'm doing great, thank you.
Good. She is a board-certified family medicine physician, and you have your clinic practice includes pediatrics, adolescents, adults, women's health, geriatrics, and you also serve inpatient and emergency care physician at Sturgis Hospital. Is that correct?
Yes.
So you've got a lot going on.
Yes. Yeah.
Yeah.
It's awesome. We get to meet people in lots of different settings, and maybe we meet them in one setting and get to interact with them in another, or we meet them in the ER and then they get to follow up with us in clinic, and it's awesome.
That is pretty crazy. So, okay, so I have to admit, I am young and I struggle with even knowing or finding a primary care physician.
Yeah.
I don't actually have one.
Right.
I think in our day and age, it's like we have urgent care,
Right.
so we go there,
Right.
and then that's it.
Sure. And so primary care has a really great role in helping bring things together.
Okay.
So it's really obvious to most people why your kids need a primary care physician, pediatrician,
Yes,
right?
absolutely.
Because you want somebody to know them and what their developmental stuff is. When we get on the more mature side of life and we have a lot of medical needs going on, maybe grandparent age, it makes sense, again, to have one person to kind of help keep it all together. But you're right, often in those middle years, it feels like, what's the point? Why would I go out of my way? Because if I need my shoulder looked at, I'll go to the ortho. And
yes, absolutely.
And the cool thing about having a primary care physician is not only do we have a lot of really talented, wonderful primary care physicians within our system that can help take care of a lot of stuff. Maybe your shoulder needs some more therapy, and maybe you don't need to go to the orthopedic physician right away. Maybe there are some steps you would need to take before that. Maybe they can get some x-rays and help you sort out what direction we're going with it. And to understand you and what your goals are. So as each individual is going to view their health and wellness different. Some people are going to be focused on what is it that gets me back to work soonest. If it's a pill, if it's a shot, you tell me what I need to do. I need to get back to work. I don't have time to be down.
Absolutely.
Maybe I have a high deductible insurance plan and I just need to keep things as simple as possible. I'm always going to give it time. I don't have time for, I don't have time for a bunch of visits. I don't want to keep coming back because each visit costs me a lot of money out of pocket. Just fix it today and then I'm not going to come back.
Yes.
Other people are really focused on the more natural approach. I don't want to take a pill. I don't want to, I'm not interested in surgery. Help me figure out how I can make this condition better without putting anything additional into my body. Yeah. And finding a primary care physician who knows you, understands you, and can help you approach your needs in that with that same perspective that you hold is really important. Yeah. It's amazing how often I have somebody come in with an issue and they're like, and I don't want to take any pills. I do. And so here are the dietary changes we're going to make that are going to help your cholesterol. Here are the exercises I'd like you to try. And if that's not enough, I'm going to set you up with physical therapy so we can do whatever we can to rehab that. Or maybe it's, thank you so much for taking time off work to come in to see me. Let's make this quick, efficient. Maybe you need some anti-inflammatories to get your shoulder feeling better so you can get back to work because this is a really important season for you or whatever. Yeah. And when you go to urgent care, they don't know you. They're great at what they do, right?
Absolutely.
My patients end up in urgent care because they need something when I'm not available. And we're lucky our urgent care providers do a really good job. Yeah. Another nice thing is if you stay within the same system, all of the notes are visible.
That's so great.
So you, as somebody who doesn't need something very often, maybe you need your screening on occasion, right? But you have a cough and you don't think you're sick, like hospital sick, but you're having a hard time getting over this. It's starting to affect work. It's affecting your sleep. So you really just need somebody to look and listen and tell you, is this the kind of thing that I just need to be patient for? Yeah. Is this something I might need antibiotics for? Am I missing something more important?
Yes, and you're like the front line. It's like having a CEO for your health
Yeah,
that's able
absolutely.
to kind of see all of the branches of medicine and also have the longevity of seeing you for so long
Yeah.
and to get to know you and what you need, and it's so tailored.
Yep, it really is.
Yeah.
And then the recommended screening, right? So a 20-year-old female still has stuff that the different medical societies are going to recommend we keep an eye on. It's not the same thing for every 20-year-old female. Your family history, your personal history, those kind of things. And a primary care provider is not only going to know that, but it's going to say, now remember, we're going to start mammograms for you at the age of 35 because of your family history, or 45 or whatever, where that's not the normal. Not everybody starts mammograms.
No.
In fact, it's actually pretty unusual to start mammograms that early, or colonoscopies.
Yeah.
But you as an individual might have a different need, might have different risks, and somebody who knows you is going to help guide that screening appropriately.
So it's really interesting that you say that, because my mother was diagnosed with cancer when she was 33. I'm 35 now. And she battled cancer until she was, for about 10 years.
Mm-hmm.
And I should be going in, having these screenings, but I'm almost afraid to go in.
Sure.
So what would you say to somebody like me who is almost afraid to go see a doctor because of what they might find?
So the fears is a really important part of getting to know each other. So if you came to see me and you said, so I'm here because I think I need to be, but honestly, I'm really worried you're going to tell me something's wrong. Yeah. My job would be to say, oh, okay, what are you specifically afraid of?
Yeah.
Well, my mom had cancer at this age. I watched her battle it, and I'm afraid if we go looking, you'll find that same cancer for me. Yeah. Okay, well, here's what that looks like based off of our current knowledge of that type of cancer. Here's what we can watch for, because some kind of cancers, there is not good screening. Other cancers, there's great screening. Colon cancer. You get colonoscopies every 10 years, and we can see most colon cancer coming from a long ways away, and we can intervene before it turns into a full-blown cancer.
Wow.
And that's why colon cancer screening is so important. I think there have been other doc talks about colon cancer screening.
Isn't it on the rise right now, colon cancer in young people?
Yeah, and so the guidelines switched not too long ago from starting screening at age 50 to age 45 for people without other risk factors. So colon cancer is one kind of cancer screening that we do routinely. Breast cancer screening for women there, and within your specific personal history, there are going to be things that put you in a category for screening for things that other people may or may not. So people who have been a smoker at different times in their life will qualify for different kinds of cancer screenings. Where if the same exact age, gender, family history person but wasn't a smoker, the non-smoker might not need the same screenings that the smoker did, even if you quit years ago.
Wow.
So again, having a primary care provider, you wouldn't know that, and you're not supposed to know that as a patient. But you coming in and saying, I don't even know where to start. Okay.
I do.
I do.
Right.
And let me help you with that.
Wow.
And then
that's
being
so
honest
true.
about, I did smoke for a while, but I quit 20 years ago. Okay. Well, based off of that history, here's what category that puts you in. There are some lifestyle things that put people in category or in higher risk categories. So IV drug use, puts people in a higher risk category for things like hepatitis C and stuff like that.
Yeah.
We screen for STDs in people who need, or sexually transmitted diseases, and people who need screening for that. And I think it's a lot easier for most people to be honest with somebody they know and trust.
Yes.
And that would be another good thing. So one of my favorite things as a family medicine doc is I get to see people when they're younger and as they grow up. And so I love having the conversation with maybe preteens about wearing helmets and screen time, right? And those kind of things that are appropriate to that age group. but then they know me and they trust me. And maybe as they're teenagers and they have other questions, other needs that it's harder for them to talk about, and they're really not going to talk about it to a stranger if they know they can trust me. And when they come in for that sports physical or their well child check,
Yes.
and their parents know that they can trust me too. And I'm not going to shy away from the tough things. And these are things we need to talk about. We're always going to make sure that the child is safe. So if there are questions that are in concern to their safety, maybe unsafe behaviors or unsafe thoughts, we're going to bring the parent in, but they know they can trust me to take care of them. And then once we get out of that age range and maybe a young female knows that they're not ready to have kids yet,
Yes.
but they want that in their future, let's talk about that. What does that look like? How do we personalize that for you as an individual? And when does cervical cancer screening start, and how does that play into all of that?
Absolutely.
And so it's really neat for young people to know they can trust us. And then as people on the other end of things, maybe they don't see me very often. They see me once a year for their wellness visit that their work insurance requires. So they've got to come and get a cholesterol checked, and I have to listen to their heart and lungs.
Yeah, what is a wellness check? Because
Right.
you know, everyone's like, oh, go get your wellness check. But like, what does that entail?
So it can be different depending on what your needs are and
Yeah.
whose version of a wellness it is. So your version as a 35-year-old female for a wellness would be, we would review your risk factors. We would review any necessary screenings that's needed. I would say, hey, I'm happy to do a skin exam if you have any molds or anything you're concerned about. And you'd say, actually, I see a dermatologist. I've seen him since I was 20 because I had, bad acne, and I just see them every few years. Okay, great. Happy to. It's not like it all has to belong to me.
Wow.
Right?
Yeah.
And so that wellness is going to look different than a 65-year-old who's just starting with Medicare. Medicare is very specific about what their wellness visits and what their preventative service visits include, and it can have everything depending on which year it is, but there's memory screenings, there's mood.
Oh, wow.
We talk about diet, nutrition. We talk about planning for who would help make decisions for you if you got to the point that you're, we would talk about what labs are necessary for screening purposes. And then depending on your primary care provider, they may do that Medicare wellness exam at one time, and then a different time would be maybe your chronic care management.
Yeah.
So we can talk about your blood pressure, and you're really working hard to lose weight by diet and lifestyle things, but maybe it's not working for you. So some people are going to split those up into 2 visits. Other primary care providers are going to make enough space at one time so a patient, we can not only do the Medicare kind of checking the boxes, making sure we address all those things that the data shows are important things to address on a regular basis, and the patient's like, actually, my knee's been hurting ever since I twisted it last winter, because that's important too.
Yeah.
That shouldn't be less important than the screening stuff.
That's incredible. And I would say the average person, right? We are so busy. I know you've got kids. I've got a kiddo. We're tired. So we kind of always put any sort of, especially, I don't know, but I feel like for women especially, we always put like our medical care just on the back burner. And so I think that just gives us even more of a reason to go see a primary care physician, because it's like, if efficiency is what you need, it's like a one-stop shop where you can just go in, hey, these are my list of things.
And so that's a really important thing to talk about. So you as a patient get to help decide what your visit is going to cover.
Okay.
And so say you're coming in because your insurance requires a wellness visit.
Yeah.
Depending on how much time is allotted for that, it's never wrong to call your doctor, your provider, or reach out to them through my chart, through the phone system, and say, hey, I'm coming in for my wellness that's required for work. I have a few other things to take care of. Will we have enough time for all of that, or should we schedule another appointment?
That's amazing. I never even knew you could ask that question.
Yeah, absolutely.
Wow.
And some providers are going to be like, yeah, or, the nurse might say, well, like, what kind of stuff? Well, my knee, and I think I might need a steroid, cream for my elbow. It worked for me in the past. And they might say, yep, absolutely. But it really depends. So and everybody who sees doctors or providers knows that some people address more at each appointment and they create space for all that other stuff. And other people see a lot of patients during the day and stay really close to on time. So as a patient, it might be more valuable for you to have a doctor that runs on time, knowing you might have to come back for a second visit. But when you come back for that second visit, you're going to be seen on time because that is, they run a really tight ship. But that means there's not a lot of extra space for add-on stuff within each visit. Or maybe you're the kind of patient and you found the kind of doctor that has more time during each visit. It just takes a little bit longer to get into them. Or you might be waiting a little bit, but you're okay with that because you know your doctor is addressing important stuff to the person in front of you.
That's a great point. My son's pediatrician. I know we're going to be in that waiting room an extra 20 minutes, but I never mind because she's there. She'll answer any question you have. Yeah.
Right. And so, but it's whatever's most important to
you as a person. Yeah.
And that's important to the doc too. We want our patients to be happy and to have their questions answered. I know as a doc, if I prescribe a medication that you don't believe in or you don't like or you have side effects from, you're not going to take it. So I would rather we have that conversation, hey, I'd like you to take this medication and here's why. And as a patient, if you can say, you know what, I need to think about that. I've heard some bad stuff about that medication. So why don't I think about it and I'll get back to you with some questions.
Gosh, why is it so hard as a patient to be honest with your physician?
Right. Because you don't want to be judged.
Yeah.
And I want people to know that it's a judgment-free zone. That's why you're coming to see us. Some of those conversations are hard. Like, I know you have diabetes. You promised me because you really don't want to be on medications. You're like, I'm going to do everything I'm supposed to get my diabetes under control without medications. And so when you come back 3 months later, a month later, and you weren't able to make those changes, that's okay. For you to come back and say, I tried, I couldn't do it, but I really don't want to take meds. That's okay. Let's have that conversation. Wow. Because just because I recommend medications doesn't mean you never have to do anything. There's always what we consider a risk and benefit conversation. So if you choose not to take the medications to treat your diabetes, here are some of the consequences of untreated diabetes. And depending on you and your experience with things, your side effects that you've experienced in the past, you might make that decision that the risk of the medication is worse than the risk of the untreated condition. But that's a conversation you get to have. Now, doing your research at home, always okay, but there's a reason you come and see a provider. There's a reason you come and see a doctor, and it's good. We want people to feel heard, understood. We want them to feel like part of the process. It's not my job to tell you what to do, but you're coming to me for my advice.
That's so true. And, I think especially with like the addition of Chat GPT in the world where we're all just like, hey, I've got these symptoms. Tell me exactly what's going on. And, you're like, well, that isn't at all what it is. So that can be probably frustrating as a physician, but
it can. And I think in my world, because I do know so many of my patients, because they're my primary care patients, I love when they're like, I know I'm not supposed to Google, but here's what it said. And I don't think it's cancer, but I thought I'd come ask you. I see that as such a compliment. If they trust me enough to come and say, I think that's probably not right, so I thought I'd come and ask your opinion, that makes me happy.
That's
because
so
I
good.
can say, I see what you're saying. I see where that concern comes from. But here's why it's not that.
Which is so good, especially for people who I was like a hypochondriac for a long time, and I would go into the doctor all the time thinking I had X, Y, Z. And so it was always so nice to be told, hey, here's the reasons why that's actually not what it is.
Right. And if you're experiencing symptoms and they are worrying you, concerning you. So, for example, with your mom with her history of cancer, if you start having a symptom that you remember her having, that's panic inducing for people. So why not go see that doctor that you already have a relationship saying, I really don't think I have cancer, but I need you to reassure me and remind me that we've done all the appropriate screening, and tell me that here's the medication here's the medication that might help me with my symptoms of getting over this abdominal discomfort or whatever. Or maybe I should be concerned and I'm minimizing it. Another thing as a primary care physician that I've noticed, and some of my colleagues have noticed, is our patients are so kind and respectful. We've gotten to know them. They trust us. We trust them. And in our part of the country, people are so respectful and so
that is true. Yeah.
And they want to make the most of your time because they know you're busy.
Yes.
And it almost saddens me in some ways, though, because people will wait longer than if I would have known what they were going through. If they would have said, called my nurse and said, I'm having this and I don't think it's a big deal. And if I were to find out about that, I'd be like, actually, that is kind of a big deal, right? And so I would love it if people would learn that it's always okay to call, send a message, and ask. We know that when we're contacting our providers, there are different ways to get a response in a different amount of time.
Okay.
So within Monument Health, we have the nurse triage line, and there's a phone number for the nurse triage line. So you, as somebody who doesn't have a primary care provider right now, and you've been sick with a cold for a week and it seems to be getting worse, but you don't even know who to ask, right? It's it's Friday at 4:00 and you're like, well, now what do I do? If it keeps getting, I don't even know what to do.
Absolutely.
Right?
Yes.
And so this nurse triage line, you can call them.
I didn't even know this was a thing.
Yes. And some insurances will have nurse triage lines too, but within Monument Health, we have the nurse triage line, and they could listen, and they're RN, so they're trained, they're capable of kind of looking at the chart and saying, well, this is concerning. I'm concerned that you are having high fevers and some shortness of breath. Our urgent care is open till this time, but honestly, that's bad enough that would warrant a trip to the emergency department. It's not that you need somebody's permission to go to the emergency department, but if you're the kind of person that, well, I don't want to be a bother.
Yes.
It's probably not a big deal, but it just seems to be getting worse. Now, if you had a primary care provider, if you had a primary care physician, you could call and see if you could talk to that nurse or leave a message for that nurse earlier in the day. But this is a service that's provided, and they can just help give you guidance. Maybe you call the nurse triage line on a Saturday morning and they tell you to, stay hydrated. Here's what we need you to watch out for. And then they would actually send me a message as your primary care provider saying, we talked to this person. Here's what we recommended. And she's aware of these things to watch out for. And we got her on your schedule for next week.
That is incredible.
Yeah, it really is.
This is selling me on primary care. So
yeah. And you don't have to. So a lot of times to stay on so for you to stay my patient, I have to see you on a once a year basis, depending on the provider. But maybe you're healthy and you're not on any meds and you don't really need labs. You can still make an appointment to see me for wellness, and we could review screening, we could review diet, we could review, I'm training for a marathon and my knees have been hurting more. Do you have any suggestions? Awesome. Sure, let's talk about that, right?
Wow.
But most of the time you're going to want to see your primary care provider at least on a yearly basis just to kind of stay in touch about all that screening stuff. If you're on medications, you might need yearly labs.
Yeah.
But not everybody needs the same thing. Not everybody needs all the labs. Maybe you're on a high deductible plan and labs cost a lot of money out of pocket.
Mm-hmm.
Have that conversation ahead of time. Like, I can do labs if you need me to, but it cost me like this much money last year. So if we don't absolutely need them, I'd rather not do them.
Wow.
And then my nurse can call and say, well, you really do need labs, but here are some, there are now labs on demand through Monument Health where you can get specific labs kind of cash price, not run through your insurance. And then I can still have access to those. And you can do it when it works into your budget, because you're on a blood pressure med. We really should keep an eye on your kidney function, your electrolytes. But I don't want to make it a financial burden for you either. We really do need to see you once a year so I can write that prescription, listen to your heart, lungs, do all that good stuff, remind you of the things you're due for screening. But you never have to do anything.
That
right?
is
It's
very
always
comforting.
an offer, an ask. You can explain why you do or don't. So there's nothing that you have to do, but until you make that relationship with somebody, it can be hard to even know what to ask.
Absolutely. Yes. And this is so helpful. So how would just like a person find a primary care physician? Like, what is the first step of finding one?
So I would say if you you're an otherwise healthy person and you need to find a primary care physician, on the Monument Health website, there's going to be the locations for where the clinics are. See if there's one that location-wise works for you, and call and say, hey, I'm a 35-year-old healthy person. I need a primary care doc, and I'd prefer a female.
Amazing. And is it okay if you go to see this physician and you're like, nope, this isn't a great fit?
Yeah.
To try again?
Yeah.
Is that something that people do?
Absolutely.
Okay.
And maybe as your needs change, right? Maybe you go from a generally healthy 60-year-old person and you're doing all this stuff more natural. You really don't need much. And then all of a sudden you have some really huge medical conditions and you're seeing a bunch of specialists. Our specialists are wonderful. And I love, as a primary care physician, being able to see the notes and touch, kind of pull the strings together. So when I have somebody that comes in and sees me for their wellness, and I can look and be like, okay, and it looks like the rheumatologist is doing this. How's that going? It looks like the orthopedic doc did this. Did that injection work for you? No? Okay, well, let me help you get back in with them, because it looks like here they wanted you to follow up, but you were feeling so good you didn't. I still think they want to see you. Let me help arrange that, right? But maybe you go from not needing much to needing a lot, but then it's nice to have that person who knows you and kind of what your needs are when you're well also. I think when people are really sick with cancer, they spend, or some of these big conditions, they spend so much time going for treatments and labs and seeing the specialists that it just gets exhausting.
Absolutely, yes.
And the thought of another doctor, and are you even going to do anything?
Absolutely.
And so that's a time when I've actually received messages from the cancer care team saying, hey, we saw your patient. She knows she's due, but she's just worn out. She'll get in touch in the near future or whatever. Or maybe they reach out and they say, the patient is calling us needing this, but they really don't want to make a trip to Rapid. Would you be able to help us out maybe by getting these labs or assessing for this? Absolutely, I'd love to.
That's wonderful.
Right, and so it's one big team effort. So if you're on a team that has a lot of people because you have a lot of needs, it's good to have one person who can kind of help juggle it and decide what's important, right? So maybe the dermatologist is somebody you were seeing every year just for a skin check, but now you've got some really important critical things going on, and you're like, why do I really need to go to the dermatologist? And I can help look back and say, yeah, actually, they were following
you
this.
You really do, though.
Or, you know what? I think they said follow up in 1 to 2 years. Let's make it 2 years this time around.
Yeah.
And that's okay.
Yeah. Oh, I really, really love that. And I feel like as a primary care, you just have to have such a breadth of knowledge because you have to have hands in everything.
We get to know, quite a bit about a lot of things, but we are so thankful for the specialists who know a whole lot about that stuff, right? And so when you come and see me for your shoulder pain and I send you to physical therapy and that's not quite enough, I'm very thankful for my colleagues who can do all the stuff you need to get you back to, whatever sport you're coaching, girls basketball or whatever it is that makes you happy. And it's kind of fun to get to see so much and learn so much. I spend a lot of time reading notes from the specialists. I'm like, that's awesome. That's cool. I can get that started now. And so when you're not even sure where to start, primary care is always a good place.
Yeah.
But if you're not at the point where you have primary care, and maybe you're seeing those specialists and you're not sure. It's always okay to ask questions, right? So like when you're going and seeing your cancer docs, they have long conversations about possible side effects of medications, or if we go this route, here are things we can expect. If we choose not to go that route, here are things we can expect. But you don't have to be a cancer patient to have those big conversations or those more in-depth conversations about medications or treatment options. Everybody who's offering a therapy, whether it's a medication, a surgery, something like that, in order to offer it, in order to perform it, they have to be able to have that conversation about risk and benefit. And we want you to ask those questions because we want you to feel just as good about taking that medication, doing that surgery, as I am about offering it.
I love that.
Yeah. And maybe you need to bring somebody with you. Maybe you're an 85-year-old lady and you love me as your doc, but every time you leave, you're like, she said I should do this pill, but I can't remember why. Because we talked about a lot of stuff. Maybe you bring your daughter. Maybe you bring a neighbor who gives you a ride just for another set of ears. That's okay. That doesn't hurt our feelings. In fact, there are times that I will ask my patients, I really need you to bring somebody with you because this conversation we're going to have next time kind of has a lot of potential for changing things. And I want to make sure you have somebody who can help remind you about the big things. Or you chose not to follow up with this specialist. Is there a reason why? Well, I just don't want to be a burden by asking for rides to Rapid all the time. Okay. I know your family, and I don't think they find you a burden. So bring them with you next time. We can all have the conversation because it's not my job, or I don't want to say it's not my job. It's not my role to call your daughter and say, oh, you need to make your mom do this. But if you have a good relationship with your mom and she says, well, Dr. Mueller says you probably should come with me, you'd be like, okay, let's make that work.
Absolutely.
Right?
Yes.
And so and a lot of people do need help with rides to appointments, and public transportation is not an easy thing. And we have ways of helping with that too. But in the end, if you have somebody who cares about you and who is offering to help, then having them as another set of ears when some of these big conversations are happening is always nice. I think most
overcome those obstacles.
Right. Or if you hear the word cancer, a lot of people, it's hard to keep thinking after that.
It really is. Yeah. Your whole body shuts down and that's it.
Right.
Yeah.
And so having somebody there who's like going to keep taking notes.
Is important.
Absolutely. So that when you walk away and they say, well, what do you think about that medication? You say, what medication?
Yes.
Right?
Well, I got it right here on page 4.
Right. And so those kind of things are not only acceptable, but encouraged. Whatever it takes for you to be comfortable and to get the information you need and to feel comfortable with a plan of treatment is what we want.
Oh my gosh. This was incredible. And this was so helpful. And I think that, it really just kind of showcases just how important primary care is. So thank you so much for coming on and talking. I know I learned so much. I love that your name is Dr. Joy Mueller because you are a joy. Your patients are so lucky.
Thank you. Thank you.
Yeah, absolutely. Thank you all for listening and hanging out with another episode of Doc Talk with Monument Health. We hope that you guys have a fabulous day. I hope you have a fabulous day.
Thank you so much.
Yeah, we'll see you guys next time.